don't trust the BMI table to let you know if you would benefit from obesity treatment or not. I'm Dr. Leslie Golden. I'm an obesity medicine specialist at Weight and Gold in Watertown in Madison, Wisconsin. And this is such an important topic, and we get it all the time of patients that come in to see us and unfortunately often have delayed opportunity to improve their quality of life, get evidence-based treatment that will add years to their life, right? So we're so used to BMI being a way to diagnose obesity and also create treatment goals for obesity of how do we know when we're in a healthier body and we're at success. And the honest truth is, like, the BMI is not accurate in that way. So if you've been told because you have a lower BMI that you wouldn't qualify for treatment, I encourage you to really consider looking further. Now, because there's multiple ways to assess obesity. So someone having more adipose, so that's the word we use for our body fat, more adipose tissue on our body that is healthful for our individual body, the location where it's distributed, or just simply the health of that tissue itself. So we may have not very much adipose tissue, but it may be incredibly unhealthy in terms of creating all kinds of inflammation, or because of where it is, maybe it's building up in our liver, making us sicker, even though there's not a lot beneath our skin. So beyond BMI, we need to know, what is our body fat percentage? What is the ratio of our body fat to our skeletal muscle mass? Where is the body fat located? If it's a lot of it is in our organs, well, we're more at risk, and we do have clinical obesity at that point, when maybe someone may look at the BMI and think that we don't. What is our waist circumference? So that number in and of itself versus, like, also what is our waist to height ratio? So these are all different ways for us to assess and determine if you as an individual would benefit from either reducing the amount of adipose tissue in your body, or redistributing it, or getting it out of certain areas to really reduce your risk, improve your quality of life, and add years to your life. There's studies that show that individuals that have moderate to even moderate obesity can add up to 8 years of their life by treating obesity. So it's important to know your numbers, but know that BMI is not the only number. And the number on the scale is not the only number, because it doesn't tell you the whole picture. So if your current provider has told you that your BMI is too low, or I don't think you have obesity, or the worst, all you need to do is just put a little more effort in, eat less, move a little bit more. If that's what you're hearing from your medical providers, please seek assessment with an obesity medicine specialist who has additional training in this condition, that can go beyond the scale weight and go beyond a BMI only evaluation, to see how your individual body and your health in terms of your metabolic health is impacting you, and if you would benefit from evidence-based treatment of this chronic disease, because it's not your fault. It's far more than willpower, and for most people it is going to require far more support than just eat less and move a little bit more. So I hope this has been helpful. If you are in the state of Wisconsin, we would love to be able to take care of you. We have physical locations in Madison and Watertown, Wisconsin, and then we can offer virtual care across the state. If you're outside of Wisconsin, please look at the American Board of Obesity Medicine website, the Obesity Medicine Association website, the Obesity Action Coalition website. There's so many incredible resources out there to help you find someone that will connect with you, that understands the science, that will dig deeper and help you get the accurate diagnosis so you can get the best treatment for you and change your life.